Today, Governor Raimondo had strong words for college students, saying they've helped push Rhode Island's coronavirus case count higher. She says small gatherings led to a spike that's now landed Rhode Island back on travel advisory lists for the tri-state area. Meanwhile, we're halfway through the second week of school, and the state has a new way of alerting communities to new cases. 12 News reporter Kim Kalunian has more on what K-12 testing has revealed and just how widespread the virus really is.
Well, parents have been asking, and now the state is delivering with an online dashboard of COVID cases broken down by school. This as a somewhat peculiar trend emerges from that data. More cases among students who are staying home. Governor Gina Raimondo outlining where the 77 COVID-19 cases associated with Rhode Island's K-12 schools are popping up.
The majority of the cases in the school community didn't happen in a school building. They were among people who never stepped foot in a school, who are instead learning virtually at home.
We wanted to know why and took the question to Department of Health Medical Director Dr. Jim McDonald during his weekly appearance on 12 News Now at 4.
There's disease spreading in the community, so this is why it's happening. I don't know that we'll always stay this way, but since there's so many kids doing virtual learning, you're going to see some of this for a while.
He's not particularly surprised or concerned by the findings and says the good news so far is that there's no evidence of person-to-person spread inside schools.
Now, I think that's because we're doing rapid case finding and because we're isolating people and quarantining the contacts.
Meanwhile, in Washington today, this from the CDC director.
More than 90% of the population remains susceptible.
About 2.3% of Rhode Islanders have had confirmed cases, which might leave out people who were asymptomatic or had a mild case. Because of that, we asked Dr. McDonald if he thinks 10% of the state's population has been infected.
I don't even know if it's that high. And I think one of the things that's behind your question is, do they even get long-term immunity? Because we don't know that yet. We're still doing research to see if that's true. Because one of the things we're all hoping for, are we going to eventually get to herd immunity? And from natural infection, we don't know that you will get long-term immunity from natural infection. That's still an open question.
And as for the vaccine for coronavirus, it is likely to be doled out to prioritized groups once it is ready. So I asked Dr. M how soon those of us who don't fall into one of those groups can expect to get a shot. He said probably next summer. I'm Kim Kalunian, 12 News.